Welcome to this class with Brie Kersak. She's got Flourish Carolina OT.com. And we send a lot of patients your way already. And I'm just excited to actually get to meet you virtually. Looking forward to meet you in person.
Right. Oh, thanks for having me.
Yeah. You want to tell me a little bit about your sort of what your inspiration was and about your business and what your favorite clients are?
Yeah.
Sure.
So I've been in OT for, do the math, 19 years and, started out in kind of a traditional medical model. I worked really in every setting and I went to OT school knowing I wanted to work in pediatrics. And I knew once I got into peds, I wasn't leaving. I did all the, exciting and stressful, you know, ICU and spinal cord units and, all the adult populations and was wonderful and loved it. And then fell into peds and I was like, I'm not leaving. This is just, this is where I belong. Worked in the traditional hospital system and just felt so burned out and limited on really looking at the big picture of kids, every 30 minutes, every 45 minutes, just in and out. And I was spending so much time behind the scenes, just, helping families. And I'm like, I really want to be able to do this with more time and longer visits. And so kind of didn't come from a family of entrepreneurs, didn't really, dream ever of starting my own practice and just took a leap of faith and launched my own space. And again, never thought I would dream of expanding that. And then here we are hiring, additional therapists, have an amazing admin who kind of handles everything behind the scenes. And so it's really evolved over time. I really fell in love with the feeding side of OT because it's such a stress point for parents, right? 3 times a day, 6 times a day. For snackers, it's 10 times a day. And I just hit a point where I was like, this is such an area that causes so much stress within the home. And I love helping people figure out why is their kid, they're always labeled. It's a colicky infant, it's a picky eater. They're being difficult. They're just behavioral. And so I really dove into the underlying components of feeding. And I was seeing mostly 6 months to, 6 years to 10 years old, kind of that window. And I kept getting these kiddos that I'm like, every single one of these, picky eaters, they had problems at the breast and bottle. And in our OT curriculum for master's and doctorate levels, like we don't get a ton of infant training. It's kind of like an afternoon and here's your, basic milestones and there you go. And so I just started taking tons of courses, tons of training, and really looking at these kids going, you struggled at the breast or bottle, or you were colicky, you were fussy, you were refluxy, you never slept. Now this is turning into you're a picky toddler, you have underlying constipation that hasn't even been detected, you're a restless sleeper. And it's like, oh no, they're in their bed for 12 hours a night. They're a great sleeper. And I'm like, no, they're not getting quality sleep. So it's kind of just evolved. And I see majority infants that are, some fresh right out of the hospital, discharged 2 days ago and they're struggling or it's a second time or third time parent that's like, we're not doing this again. They're making an appointment before their due date. They've even made it to the hospital. And then as a whole, our practice as a whole, we see kiddos of all ages. So we're seeing teenagers that are coming in socially. It's starting to bother them. Hey, I go with my friends after the soccer game and they all go to this restaurant and I'm so stressed out about not finding something safe and comfortable to eat. And I don't want everyone staring at me. And so, the older kiddos, when it starts hitting camp season and these social challenges, they go to their parents or the parents say, hey, let's get some support. So we're really diving in on the big kids saying, why are you struggling with eating? 99% of the time, it's not behavioral. They're not choosing this. It's either undetected, gut imbalances that are driving carbs and sugar. It's a lot of times an oral dysfunction issue that tongue can't reach the back molar. So I'll get kids that come in office and, I'm doing a full oral exam and they can't move their tongue. They can't reach their back teeth. I'm like, so how are we chewing steak or chicken or vegetables that you can't chew that up front? It's got to move back here. So we're really looking at the big picture and how feeding and airway ties into sleep, quality sleep, ties into then daytime behavior, ties into digestion. So you're not chewing correctly, you're not digesting correctly, then that causes constipation. It becomes a hamster wheel. So a lot of times parents just come in thinking I'm going to give them this magic wand to get them to eat chicken and broccoli on the way out, and they're blindsided saying, "Oh my gosh, this makes sense." They're not, they might be pooping 4 times a day, but it's not, a quality stool. And they're like, no, they can't be constipated. I'm like, no, we're going to investigate. I want pictures. I want tracking. All of that to say, we kind of look at the big picture of kids. Just, we often get the kiddos that, oh, we've been in OT for a year, but we just can't nail down like what's going on, or we're still having a behavior issue, or we're still struggling with feeding. So we like to kind of be the detectives that dig and look the lifespan. I bring parents back to infancy and say, okay, you gotta dig with me and remember what was breast and bottle feeding like. And a lot of times it's like, it was so awful, I just blacked it out.
So, yeah, it's kinda interesting. I just had a friend's grandson have some feeding problems, and they thought it was just poor sleeping, and they did some sleep training, and then still and they saw their insurance. They went to someone, and they did an assessment. They're like, "Oh, everything's fine." But actually, it turned out the poor kid, he's just mouth breathing. He can't breathe through his nose, so he's, like, gagging for food because and when I was trying to say that, it was like it's like, "Let's close our nose and actually see if you could swallow." And if you're having a hard time swallowing, you're like, this is what the kid is feeling is when they're trying to eat, and they're like, "Wow." It's like,
I'll have
"Hey."
it's so funny that, when I'm evaluating their child, you can see them start to do some of the same movements. If it's an older kiddo and they're imitating tongue, sticking their tongue out, moving it side to side, you can see the parents kind of start to do things. And then, if I identify the big buzzy topic of, tongue ties and oral restrictions, they're like, well, am I tied? Well, I had all this dental work, or I was in speech therapy as a kid. You can see their gears turning, and I do a lot of demonstration for them and say, match this. Can you do this with your own tongue? And it's usually, they'll get a little embarrassed and red faced. And I'm like, no, I'm not calling you guys out, here in the appointment. This is information for you as well. And it can sometimes be really encouraging for parents to say, oh my gosh, maybe this explains some of my challenges that were just kind of normalized and blown off. And I want better for my kiddo. And now, it sometimes gives them answers to those exact problems.
In your 20 years, do you feel like this is becoming more prevalent or just that we're just are more aware of it, and so now like, I feel like I don't know, when I was growing up, maybe our parents didn't care or, like, we just didn't care, but we just somehow survived and,
Right. Right.
like
We thrived on, we were a family that it was a meat and a vegetable and a starch and a fruit or a dessert. Like, it was a very well-balanced meal. And that's kind of just what I always knew. So that's such a loaded question, because I think now, for you go to a sports event and your kiddo is playing, little soccer shots or something like that. At the end, if it's sign up for snacks, it's so wild to me what the norm is to bring, right? It's packaged, processed. And I'm like, okay, wait a minute. Or a birthday party in school. I'm like, you want this child to sit here and pay attention and be able to organize their emotions and learn and keep them, follow the rules, yet we're loading them with these artificial ingredients that we know are not good. And I always say to parents, I am not judging anyone's diet that walks in my room. You can tell me you drive to McDonald's 3 times a day. I'm here to help you. But I think there's a lot more detection when it comes to oral motor skills. Breast and bottle feeding, a lot more for moms. We had this big wave where it was for years and years, it was just bottle feeding. No one was really breastfeeding. You were the outlier, and now that's kind of shifted. And so, while in my years, I'm seeing so many more kids tied and have oral tension, body tension, they're coming out. They're not Babies should not come out lifting their head, looking all around. They should be floppy. And I'm seeing so much tension, just head to toe. And so the ties, oral, lip and tongue ties, cheek ties, they're everywhere. I mean, I have to, like, oftentimes the friends that have kids, I'm like, can I just assess your baby? Can I just feel in their mouth? Because I need all day long. People are bringing me their babies that are struggling, right? So I'm going to find the problem. I'm like, I always need that baby that's not having any issues. I'm like, okay, let me feel their body, let me feel their mouths. All right, these babies do exist. So I think the prevalence is a lot higher. I think the awareness of, social media and moms groups and parents talking, saying, no, I'm not going to be okay with my baby spitting up 30 times a day. I mean, I just had a kiddo that spit up upwards of 40 times a day for 10 months. And then at 10 months old, it just went away. And I'm like, how are we normalizing that? Like, nothing about that is okay. And so
Why do you think the prevalence is increasing? Do you think it has to do with the multivitamins, the folic acid
I mean,
vitamins, or
that's what the research is pointing to. We're really looking at the MTHFR saying, okay, how much of this is playing into it? I also can't help but wonder, not even just a methylation standpoint, but we moms, the exposure of all of the toxins, all of the environmental factors, our stress level, right? What is happening to these babies in utero? I'm not saying my stress level grew a kid's tongue tie. I'm not saying that, but is it all of the things combined? That is where the research is pointing that we know MTHFR is playing potentially playing a role and folic acid, in utero. Is that it? Is our detection better? We have more moms that are coming in saying, I really want to breastfeed. Help me figure out why this is a struggle. Or my baby will breastfeed beautifully, but they refuse to take a bottle. And the doctor's saying, just leave for that afternoon and give them to dad. And they'll, if they're hungry enough, they'll figure it out. So I think in infancy, once if it's normalized and we just figure it out by moving to bottle or, stopping breast, it shows back up. It shows up as the 3-year-old that then is a picky eater. It shows up as the 5-year-old that's, ADHD and can't keep it together in school. It's like they might really have inattention, but are they sleeping? Where is their tongue posture? So we're missing a lot of those underlying pieces. So I think a lot of it is detection, and parents really, that's the plus of social media. They want more. They want more information. They're looking at their friends saying, I'm not settled with just saying this is okay. I want to find out why.
right? So you mentioned constipation. Tell me about how all that's connected.
Yeah. So, it's funny because I always tell parents once we stop wiping our kiddos' bottoms, we don't really know what their poops look like unless they tell us, or, it's just they're independent and away they go. And so I became pelvic floor trained because I really found how can I be a feeding therapist and address the upper half when once that food is swallowed, there's so much more, part of the digestive tract that goes into picky eating and problem feeding. And so a lot of times kiddos will come in as picky eaters and they're, whether they're constantly grazing or they're just a high carbs, high sugar kiddo, I'm saying we need to investigate what is happening with their digestive system. I need tracking. So if they're in, preschool or daycare or school, I'm showing the kids, here's a Bristol stool chart. And I want you to go home and say, after math class, I went to the bathroom and my poop looked just like this. And tell mom about the color and tell them, I'm telling parents, like, I want you to track, wow, that was really, really dark and had a really strong odor. Or, I want to know what is happening with their poop. And it's uncomfortable for a lot of people to talk about. They're like,
Mhm.
we're for feeding. Why are we talking about? I'm like, I got to know what's going in and what's coming out. And so if kiddos are not chewing correctly and fully chewing, I see a lot of kids that do premature swallows. So food goes in, they chew a little bit and they do kind of, I always say, look for the grimace. They kind of have a hard swallow. If they are doing a hard swallow or they are overstuffing, they are likely creating constipation because they're not breaking down the food. They're not getting out the nutrients that full mastication, full chewing need. The body needs that. And so if they're constipated, I always say that balloon starts stretching and it's storing stool. And we might be pooping a little bit out, but that poop is still working on the outside of the balloon. And so if we're not emptying those bowels, and the emptying could be they're pooping 4 times a day. Well, that does not mean they're emptying. They could just be getting rid of some. And so that stool being toxic in the GI tract then turns into, do we have imbalances? Do we end up with a leaky gut? Then it starts to mess up the whole microbiome. Then we start having, vitamin and mineral imbalances, and they're craving certain things or avoiding certain things based on now they're imbalanced. And so the constipation piece is hands down the most overlooked piece that parents just have no idea because they're not talking about it. And I'm like, no, we need to talk about it. We need to track it. Kid, if you're coming in with concerns of picky eating in your child, I'm requesting stool tracking. I want to know everything for 7 days. What do their poops look like? And it's pretty eye-opening. Sometimes parents are like, "Oh my gosh, I didn't know they're pooping every 5 days. No wonder."
Oh gosh, my little TMI, but yeah, growing up myself, my mother never, I remember never talking about that. And I was terribly constipated growing up. I pooped like once a week. And when my mom didn't even know until probably about 5 or 6 years ago, she's like, "What?"
Yeah.
I was like, "Yeah, just I didn't know that was not normal." Like, and
Well,
it was
no, duh.
terrible.
Yeah, because it's like, well, why do I wanna sit at the lunch table or at my friend's sleepover and share about my bowel habits? And you don't know what's abnormal until you learn what's normal. And if that's your baseline, it's like, what do you mean you poop every day? No, like, no, I only poop every 5 days. Like, it's just, you don't know.
I try to remember to attach a Bristol stool chart to this video too. I mean, I sit there, like, with the kids, like, they're like, "I don't wanna look," and so I just kinda giggle with them, like,
Yep,
try to, like, meet them on the goofy stage,
you're
but
exactly right. It's always
then they look.
the older boys, and they're like, I'll say, do you know why mom and dad brought you here today? And yeah, we got to talk about, I'm not eating. And I'm like, so we're going to talk about what you're eating and what you're not eating. But I was like, we have to talk about something that everyone in the world does. We poop. And they're like, oh my gosh, like really, they're so embarrassed. And it's like, you got to lighten the mood and just say, hey, we all do it. And this information, I'm like, I'll often say to kiddos, I'm like, what if you actually don't have a feeding problem? You have a pooping problem. Wouldn't that be cool? We could just fix the pooping problem and then you'll eat. And they're like, okay.
So for the constipation, it's mostly in your realm that you're able to work with is more of the, just the not chewing and it just being too big. Because I know when I see that, but also in my world, I see a lot of people with gluten issues. A lot of people think gluten causes diarrhea. Gluten can cause terrible constipation, and I had to learn that one the hard way with me and my daughter, and that's when I finally learned it when my daughter was old enough. I'm like, "Oh my gosh, this is,"
Why?
I was like, actually, this is why I got so much better when I started eating healthier when I was older. Because when I grew up, everything for us was, like, macaroni soup and, like, sugar toast. It was terrible, like, it was terrible, and so when I started eating more fruits and vegetables, like, I can actually poop every day? Kinda cool, and so it's like the food quality
Yeah.
clearly, but also
And that's the thing.
constipation.
A kiddo that's old enough to understand, I say to them, I do not care what you eat and what you don't eat. Your parents care, and that's why they brought you here. But my job is to help you figure out why you're not eating or why you're not pooping or why you're not sleeping. And like, we're all a team and we're going to figure out a plan on how to fix all of those things. And it doesn't happen overnight. It's a lifestyle change for a lot of families. And it's hard, but I think sometimes when kiddos have underlying undetected constipation, the biggest thing that parents will see is if they have a bowel movement, the next 24 hours or the next 36 hours, they just eat, eat, eat. And so parents, when they're saying, oh, every once in a while, well, they'll eat a really good breakfast or they'll eat what I'm serving for dinner and they want 3 helpings of it. And then we go right back to nope, 2 days later, I'm not hungry or I just want a snack. And I'm like, that right there, you empty those bowels, you just made room. So that can be, a really helpful tip for parents that if you are seeing big fluctuation in the volume of what your kid's eating, that absolutely needs we have to investigate frequency of their stooling. I want to know color. I want to know how do you describe odor, right? But sometimes it can be parents are like, oh my gosh, it really has this same kind of smell, or it really has every once in a while, if it's this color, it'll have a different smell. I'm like, that's important. That tells us a lot about what's happening down low. And so I work closely. I'll refer out I don't do a lot of pelvic floor therapy. I'll send out for it if a kiddo is severely like, we have rectal stretching that is not going back and we can't get on. But if they're seeing kind of a traditionally trained pediatrician, they're going to just throw them on Miralax. Like I'll push for a KUB x-ray and realize that they're fully impacted. And I'm like, okay, wait a minute. Under my pelvic floor scope, we can talk about different ways to manage this. We need your doctor on board. But it's very just like, oh yeah, they're constipated here. Just take some Miralax and go. And I'm like, no, no, no. Like what caused them to get there and how can we prevent staying there? Because if you're not pooping, you're not eating correctly, you're not sleeping correctly, your behavior, your mood, all of it.
I mean, if an adult thinks about it, if you're constipated, you don't feel good anyway. Like, you just don't feel good. You get
I
headaches and you just.
I tell parents, I say, go to a holiday party, go to a birthday party, eat, drink, do whatever on that Friday night. You wake up Saturday, well, it's my usual breakfast time, but I just feel blah, like I feel off. And then you might eat, maybe not, maybe you might snack around. Lunch hits. If you haven't had a bowel movement, your body's still like, I'm still feeling heavy. And so, how can kids sit in school and focus? How can they go to sports? Again, if they don't know any different and that's their norm, they don't think to tell anybody, like, I'm having a hard time focusing in school because I haven't pooped in 5 days. They just, they don't know.
So how much of the whole chicken nugget and french fry epidemic is related to oral function? It's like it's so interesting because you have these families and they're like, that is all they will eat. So
Yep.
tell me, like, when you have that kid that's all they'll eat are chicken nuggets and fries. Tell me more about that.
So I'm going to look at is, can they eat? A lot of times kiddos are struggling with the actual function of chewing and swallowing. And, a non-medical, a non-feeding parent doesn't know to look at that. Oh yeah, they kind of overstuff their mouth, or, oh yeah, they eat really fast, or they sit at the table for 60 minutes. We're all done, 35 minutes ago and they're still sitting there. So I tell parents, first off, they come in, a little sheepish and like, gosh, I'm on the stand and I'm like, hey, you're here because you want help. This is great. We're going to figure this out. I think that there's a combination of when kids miss the milestones necessary for chewing and swallowing, like as a parent, we learn general milestones. My kid needs to do tummy time, they need to roll, they need to sit, they need to crawl, they need to crawl despite what some recommendations say, and they need to walk. No one knows that there's actually milestones of the mouth. And so when those are missed, who's looking at that? They're not getting that in their general well check. Like, nobody's assessing that function. It's just, do they eat 3 meals a day and snack, or do they not? And so when kids miss those skills, it often comes around that time of 18 months, 24, even up to 36 months. They hit that 2 to 3 mark and it's like, oh yeah, they're just being a toddler. They're just being picky. And it's like, okay, wait a minute. That is a normal developmental, social emotional stage for kiddos to kind of have some autonomy and power. Like, nope, I'm actually not eating your, rice casserole tonight. That is different than we are dropping food groups. So if we are losing meats, we are losing vegetables. If you can't say, they only eat this chicken nugget from this bag and this brand, then I first am going to look, that's likely not a sensory issue. It's likely not a behavioral issue. It's likely a function issue. And they've learned this chicken nugget that is actually mashed up chicken and then reformed, right? Is
Mhm.
a lot different. Dad's over here grilling out, not, teriyaki chicken breast. And it's like, Johnny, eat this chicken. It's the same thing. No, it's not. That is actually two very different skills of eating. So think of eating steamed broccoli to roasted broccoli. It feels very different in your mouth. That is a sensory
Right.
experience, but it also requires different levels of chewing. And so when kiddos get stuck in this brand, this item from this box or from this place, fast food or restaurant, store, whatever, first we have to look at function. I always say, I think I've met less than 10 kids that have a behavioral feeding problem in my career. They often have a function issue that was undetected, and then it naturally pushes them just into, this is what's easy. This is what doesn't have resistance. This is what's safe. So when we get down to packages and brands, like they'll eat, oh, I'm going to try to buy the better version of Doritos, the Siete brand. Well, of course, it tastes different. It's not loaded with crap. I'm looking at the big picture of saying, okay, is that a flavor profile? Is that a preference? Or is that a skill deficit? I always come into every case saying, I'm assuming there's a skill deficit because, and that may have turned behavior and may have turned emotional, but 99% of the time, there's a deficit first. And then you just go to what's easy and what's comfortable. And then as a parent, life is busy. We're working, we're running to sports, we're picking up, drop off. Like, I don't blame a parent where there's nights where it's like, hey, we got to do some easy food, But if that is what kids are living off of, check skill first. They need to be coming to you from a gut standpoint to say, what's going on internally that could be driving this? And then let's look at them together, because then we have to undo those patterns that they've set in their mind that I can't eat this brand of chicken nuggets. I'm only eating this one.
Fascinating.
It's so cool. I mean, it's such
Yeah.
it's almost like learning a language, and they get really excited when I identify the problem, but I tell them, "You gotta buckle up with me. This is a long road of undoing, and some kids move faster than others, but I'm not sitting around in our office. We're not licking, tasting, dancing food across the internet. Get them in the kitchen and they'll cook with you and they'll eat it. good luck. If you can get them in the kitchen and then they eat it, that's then more underlying behavior. That's choice. But if they will sit there and make all the food and they're not eating it, there's another reason why. And we got to figure that out. They're not doing it to give you a hard time. They're having a hard time.
Gosh, I definitely wish we had more of this training in medical school for family physicians and pediatricians completely because it all that is like the domino effect to so many other things. Like you said, sleep, the tension, like missed days from school, confidence, all those things. Can you go through kind of have a quick sort of age group, like whatever I'm saying, 0 to 1, a toddler, school age, sort of some top maybe two or three things to recognize that this is a time to come see someone like you,
Ah,
your kids.
Great question. So we'll break up kind of 0 to 6 months, breast and bottle. If baby is struggling on one area or the other, there is something usually going on, oral motor, their function. So if they're a great breastfeeder, that they just don't get exposed to bottles, ramp up exposure. I always tell people you don't have to do it in volume. They don't have to have 5 bottles a day, but practice once a day and see, is there a motor skill? So that would be a red flag. Struggling one area or both. Number two red flag for 0 to 6 months, I would say anything that you get like normalized. Oh, they're colicky, they're fussy, they're just a high needs baby. I don't buy that. I do not buy the term colic at all. There is a reason why your child is screaming and crying and uncomfortable, and we need to figure that out. So if they're not progressing breast or bottle and they are just unsettled and you're being told, oh, they're not sleeping, you just need to sleep train them, we're going to wreck their nervous system. We need to figure out what is going on. So that's kind of that age group. 6 to 12 months. Food, there's a big saying, food before one is just for fun. It is for fun, but it is for learning. There are vital oral motor milestones that happen between 6 to 12 months. Now, just like kiddos crawl and walk at different ages, I'm okay if they learn to eat at different ages, especially among sibling sets. A lot of times, if we have a really good eater in our older child, the second child, the parents are like, oh my gosh, they're not doing it. Their brother or their sister was so much further ahead. That's okay. That doesn't mean there's something wrong. But red flags from 6 to 12 months, if they are not progressing onto table foods from between 10 and 12 months, and that could be ripped up. It could be baby led cert. However, everyone kind of has their own opinion. I'm very big on do a blend. I still like some purees. I love baby led. I like a mixture of both. If we are seeing frequent gagging, if we gagging is part of learning, that should go away in the first couple weeks. We should not be having these big exaggerated gags. So 6 to 12 months, if we're hitting that 9 to 10 month mark and we are not having a variety of fruits, vegetables, maybe starting to eat, like introduce meats. Again, everybody does their own pathway of what are their first foods they're going to intro. But if they are not progressing, that we can hit 12 months and say they can engage in a family meal that we've kind of deconstructed and, tore up safely for them, get them help, get them an evaluation. Because I will see kiddos in the 6 to 12 month mark that have a minor, they just need help moving the food or they just need parents to help place it or teach them something that the internet is saying, don't you dare spoon feed or don't you dare give them a bite. But what if we need to teach them how to move their tongue to go get the food? So 6 to 12, if they are not progressing, sometimes it's one visit. I'll see a kiddo and I'm like, do this little trick, do this little trick. And they go home and they're eating everything and I never have to see them again. So if by their first birthday, you as a parent are not feeling comfortable about what they're doing, get an evaluation at that point. Don't wait because 12, I'm going to say 1 to 2, that is where you're getting a little more brave. Let's say you've had a good eater, you're getting a little more brave in the serving sizes. We're moving up in pieces. So we're not doing teeny tiny little pieces or straight baby led. We're wanting them to bite off of a piece of sourdough. We're wanting them to have a piece of fajita chicken and be able to manage the bite size. So if from 12 to 24 months, especially 18 to 24, that 18 to 24, we know how 18-month-olds are, right? If they are starting to lose foods that you say they loved as a baby, and it's simply because we've moved up in size. Now, pureed broccoli is going to be a lot different than eating whole broccoli. But if we are dropping food groups, I can't really get them to eat vegetables. They're not really loving meat. If by 2 years old, you're telling me your child doesn't like the texture of meat, I call it they likely don't have the skills and endurance to chew and swallow meat. So, huge red flag in there. 18 to 24 months, if we've dropped food groups as a whole and we're moving into a soft, I call it the tan carbs, yogurt, quesadillas, bread, pasta, cereal, that family, there is an oral motor function issue 99% of the time. And then I would say from 2 to 3, if they, again, continue to drop food groups and their repertoire of what they're willing to eat is shrinking, if you can say, okay, they don't really like when I make roasted carrots, but they'll eat raw carrots. Or my kid really, this one really likes, cucumbers, but they have to have something to dip into it. Great. So if they are setting rules over what they will eat and you've offered multiple different ways to serve it, like, okay, some kids just don't like cucumbers, move on to a different vegetable. Then if you can move within a food group, within meats, within fruits, within vegetables, within carbs, and they are flexible, great. If they're not, again, it's another red flag. So, there's kind of a saying in the feeding world that the skills we have at 3 is what we have at 33. And while our taste buds might change, our motor skills of our mouth and our advancements in our strength and our endurance chewing, if that between 2 and 3, you're gaining a picky eater, it's probably going to be a downward slope from there. That's not going to just be they're going to wake up at 4 and like, oh, they're going to try other things. They might be a little flexible, but it's usually kind of set at that point of their repertoire and what they're willing to eat. And then, I love the older kids. We get teenagers all the time. And like I said, it's camp, it's friendships, it's dating, like they're going to start a totally new part of their life. And that's stressful to have to think about food and be nervous or embarrassed about it. And so it's never too late. We get kiddos that I have, I've had a few on growth hormone, and it's been a breathing and an eating issue. And so if they're not breathing correctly, that is the first thing that will mess with their hormones and their, insulin, their cortisol, all of these things. And that's not often checked into. It's like, oh, who would think to look
Right.
now? We just know they're small and they're not growing or they don't eat enough. Well, can they eat? So
Wow. Yeah, honestly, I'm learning so much. Now, for the teenagers, is it that what is their anxiety about? Is it that they're maybe smacking their food and they can't figure out how to like not smack their food? Like, what are the common complaints that they have? Because I'm just hearing it's more of the social aspect of it, but what are they complaining of whenever they come see
a
you?
lot of it's like fear, right? They come in and they're like, okay, my friends all want to go to a burger place and I don't eat burgers. And so I can't even think of something on the menu that, maybe they'll be comfortable getting fries, but then it starts to become social. Like, why are you only getting French fries? Like, are you not hungry? And it puts them on the spot. So the majority of times for the big kids, they think that they have something wrong with themselves, that it's a fear issue. And they, I don't like these foods and I don't want to have to explain it publicly. A lot of times it's a motor issue that was undetected, and we teach them how to chew correctly, how to spit food out, or how to get withdraw food that you took a bite of something, you're starting to feel really stressed. How do you do that socially? And so we work through finding out why are they having trouble eating, and then we fix that. Say it's a mechanical issue and it's a chewing issue. Once we fix that, a lot of these kiddos, they emotionally, they just take off and they're like, I'll tell them, I just had a 16-year-old that we identified a tongue tie. The kid has been in braces. He's done all of these things. No one has ever identified his tongue tie. We have worked on the mobility of his tongue and his chewing. And now he's eating all of the things because I said to him, I'm like, it's your tongue's fault. It's not your brain's fault, not your heart's fault. Like, you've been wanting to do this. Your tongue, it's like me tying your shoelaces together and saying, go be a better cross country runner. Well,
Well,
that's
that's why we have a local orthodontist, Dr. Austin, who's an
okay.
Airway orthodontist.
Yeah.
And it's like even my own kids, she was needing. I knew she's going to need braces, but I just waited. I was like, I'm waiting to learn something. Something's not sitting right with me just to go get her braces, right? And I'm so thankful she's getting myofunctional therapy, and now she's seeing Dr. Austin, and she's getting way more work than I ever realized she needed. But I'm so thankful and wish I'd have known a long time ago. Like, but just the fact that she's been to the dentist all these years and like no
Yeah.
one noticed her tongue tie, no one noticed like all this dysfunction in her mouth, her
Yeah.
bite. I
Yeah.
mean, it is blowing my mind. This is actually partially what inspired me to do this. That's because she's 16 years old, really having to do a lot so late in her years that we could have fixed forever ago, like, and just
That's
prevented so
amazing
much.
that you're doing it because I'll see so many kiddos that the parents understand, oh my gosh, well, maybe I'm tongue tied or my bite doesn't align or I don't sleep well. And I always say to people, I love being a feeding therapist, but I love helping people learn to breathe because if a baby's not breathing well, they're not sleeping well. Anyone who's not breathing, if you're not breathing correctly, which is tongue suction to the roof of the mouth, lips closed and nasal breathing, you are not eating correctly, pooping correctly, sleeping correctly, and behaving correctly. You're not. It is impossible. And so I love the big kids. I love seeing all ages, but the big kids, it's so rewarding because they're like, I've spent all these years with all these troubles, and I just thought there was something wrong with me. I thought I was being a bad kid and giving my mom and dad a hard time not wanting to eat
Mm.
their dinners. And it's like, no, you haven't been able to eat. So, if we can really fix this and stop this and get education out in infancy. And there's also a whole side of, you know, it's overblown and like, oh my gosh, you have a tongue tie. You go tomorrow and go get it released. No, you wouldn't go run a marathon tomorrow. You trained for it. So there's a whole educational component of when is the right time to do these things for kids. And I tell parents all the time, it's never too late. It's not too late that she went and got her braces and myo and expansion and all the things at 16. I put my 4-year-old in an expander to help promote airway. It's never a wrong time to address it, and it's like, know better, do better. When you learn more, we do it, and that's okay.
And definitely, I'll be interviewing some more people about the airway things, about using a lot of the sucking sort of pureed foods and the passies. I mean, I was totally guilty of the passy and the bottle. My mother loves the passy in the bottle. Now she knows, and I was like, oh, they'll be fine. We'll fix it later. Oh no, I totally like. I
Yeah,
feel like my entire practice is built based upon how I messed up my own kids. I was like, "Oh my goodness," but it matters the texture of the food, it matters how the majority of the food that they are eating. I mean, there's just so much that
but
I've
it's
learned with the
on the
last.
side that, there's a push that we didn't really have. I mean, my boys are almost 9 and 10, and we didn't have baby-led weaning was like, you have to do baby-led weaning. Well, in true baby-led weaning, it's like you just serve the food and they go and they figure it out. I'm actually not a proponent of I tell parents, I love when kids learn to eat real food, real steamed cauliflower or roasted cauliflower. But I also am okay with the kiddos starting out on purees if they've had a tongue tie release as a baby, if they've parents are really, really nervous about that. Cause on the flip side, I'll get kiddos that come into my office and it's like egg strips, baby led weaning. It's a classic, make an egg and then strip it up. These kids will take this egg strip, they're flopping it around their face, they're slurping it, they're sucking it, they're not chewing it. But I go and I take a pinch off a little piece of, say, rotisserie chicken or ground turkey, and I help and I tuck that into the cheek, and all of a sudden you see and the parent's like, "Oh my gosh, I've never seen them chew." And I'm like, "Well, yeah, because 'cause they're eating an egg strip as big as their head and they're flopping it all around." So it's like, there's no people are always like, "Why don't you teach a course on, like, how to feed kids?" And I'm like, "Well, it's so individualized in, like, 10 people signing up to run a marathon, their training programs should be 10 different ways." And so it's knowing what does their foundational skill look like and how to build upon that. I'm a big fan of a lot of variety. Don't just do baby led. Let them have a spoon, load the yogurt for them and let them, figure it out or help them. That's okay too. So
Yeah.
there's a lot of rules out there that are extreme on both ends. And I think that just it creates confusion for parents. I'm like, go slow, follow your own intuition. And I always say teach your child to eat like you guys eat as a family. And if you need support as a family learning healthier ways and things like that, I can help with that. That's part of feeding. So,
There's so many parts about the development of kids that some of it was like there's old wisdom, and part of what I am now I'm feeling inspired through fame of medicine is how do we help the mom become the medicine woman of the house again? Because we're all like now having children without the help of our grandparents and aunts, in more traditional cultures, you're gonna have all the aunties and the grandparents and they pass things down. But we've been through a whole industrialization of motherhood in the last 100 years, and no one really knows what to do
you're
for
so right.
for ancient things, like for the things that has been here since the beginning, literally, of time. Suddenly, we don't know how to do the basic things, and even down to, like, and it's kind of off topic, like MNRI. like occupational therapy, like I'm going to be interviewing someone about that too. And just about how we're carrying babies, we put them in carriers and baby seats and they never touch the ground. And how
Right.
important even that is just for so many things. And so now between the feeding and making sure they're having reflex integration just for normal development, and kids are not developing normally because
No.
we're trying to help them. We're enabling them so much they can't just be actual on the floor kids. Their whole floor, their universe should be the floor pretty much.
The containers. I always say things are what are wrecking the development of kids, right? There's again back to the extremes of like, okay, attached parenting and responding to your baby where people all have people coming in that are sleep training their child who is a terrible breast or bottle feeder. I'm like, we are telling their nervous system, shut off, no one's coming, even though your body's telling you you're hungry, you're refluxing, you're uncomfortable. It's like, we're again going to extremes of like I have to follow this really strict schedule. Or the opposite of sometimes I have to gently say to a parent like, I know you love your baby carrier and I loved mine too. I need you to get them on the floor. No Bjorn bouncer, no skip hop this gadget. They need to be on the floor. They need to spend some time moving around, like fighting into tummy time a little bit. Like that's healthy because that is how they're going to learn to tolerate tummy time, which plays into rolling, which plays into crawling. I mean, primitive reflex work is again the same thing, a foundational, it plays a part into breathing, it plays a part into handwriting and reading and driving. I mean, there's so many things that we're kind of missing. And I always, I say to moms because I feel bad. I'm a working mom. Like I know we need some things out of convenience, but if we shut off the noise and just lean into our own intuition, sometimes I feel like our kids would be better off than to follow rules that are set. I'm like, who are they set by? Do they know you? Do they know your lifestyle? It's like buy all these things on your baby registry. I'm like, you need some diapers, you need the baby, you need some onesies. Like, no, we don't need all the stuff because more stuff, the gadgets are causing problems.
Yes, and even then, I even think about the Bluetooth, all the Bluetooth equipment around babies. Like we know now how bad this is for the brain. So
Yeah.
everyone out there, avoid Bluetooth things for your babies. Like just if at all possible. There's so much. And thank God we live in a time right now where we're figuring this out. Our parents did not have access to information
Right.
like we have. And then we had access to so much, and it's hard to even know what's real, what's not real. But most of the stuff I felt like I had access to were things to buy, it was like things to get to when really the answer is like way more simple.
Right. I mean, you think back from a feeding standpoint, what did our parents and grandparents do? They served what they were eating. They served it mashed down or pureed or blended or, took a fork and mashed and go. Like there wasn't, and again, on the flip side, it's nice having some convenience, right? There's Little Spoon, there's other companies that are coming out with nutritious convenience. And that's good. That's not accessible for everybody. But, it is. I feel like if we could go back and utilize some of the things from, 100 years ago and simplify, I think our development is very much impacted by
I
it.
think it was actually about 100 years ago is when it started shifting, when Gerber came out with a baby food that was scientifically proven to nourish your baby. And then suddenly you're like, and all the moms doing the very best they knew how to do for their kids went and bought this scientifically proven baby food that then started the downward spiral. And everyone truly, and everyone, just anyone listening, like, we're all doing the best we know how to do.
Uh, Yep. I mean, if I could go back, I always say to a mom that's pregnant, I'm like, write your I will never list. That I will never do that. I will never you judge people, for the things that they do. And then you go and do it. And it's like, oh my gosh, I will never ride in the back seat with the baby carrier. I rode home from the hospital holding Cohen's head in the car seat because I was like, I think he's going to die with his head like that. It's just all the I will nevers that it's funny because we evolve and we know more and we do. I just say no, know better, do better. When we learn different things, like we're all doing the best we can. And there's anything in our talk today, there's no judgment. I don't want anyone to gasp and be like, well, I did this. And, my baby was gagging at 9 months. I should have gone to see Brie. It's not too late, you know?
Right. So, yes, all that is just it's remembering who we are as women, and trusting our intuition and go to someone that you feel heard by and know that it's okay to change your mind about how you're doing things. Changing, I think some of us get stuck in like, well, I'm right, and so we want to hold on to, or you have grandma like, oh no, this way it has to be. But truly, half the time, grandma like was part of the industrialization. Like she's doing the best she can too. We're all doing the best we can. But tell me about the sleep. It's talked about the most overlooked. You said the most overlooked problem in children is like sleep. Tell me more about that.
Yeah. So, again, when your kiddo goes in their room and you stop using a monitor, then we're just like, okay, see you in the morning. So we don't know about the quality of their sleep. And I find that if I get kiddos that are coming in for, behavioral challenges, or it's like, okay, we've been doing therapy for a while, or we're having problems at school, but we don't really see it at home, or vice versa, or they hold it together all day at school. I always say, I want data. I want to know exactly what is happening, just like with poop. I want to know exactly what's happening in the night, because you and I know we may get an 8-hour night and it's our brain was racing before we went to bed and we were worried about something, and we wake up the next morning and you're like, dang, I got my 8 hours or 7 hours or whatever you get. But it's like, I don't feel well rested. And so, society, there's so many demands on kids, right? We got to hold it together all day at school, and we got to hurry home and do our homework and then go to sports and eat dinner and get everything ready for the next day. It's always a rat race. And if you're not getting quality sleep, these kids they're tired. And so I see sleep being overlooked in 100% of ADHD cases. I do not get a kiddo. If they have an ADHD diagnosis, I have yet to have a child that has had a sleep workup that you know, parents are like, oh my gosh, I think that this is contributing. Most of the time, I'm the one detecting that. And so it a kiddo is not getting quality sleep, whether it's stress and nervous system, and they're not able to wind down and shut down and get their body into the correct cycles of core, REM, and deep sleep. If they are mouth breathing, I mean, if you're, doing a podcast on myofunctional therapy, you're going to go all into breathing and reflexes. So if a kiddo, babies, adults, they're not breathing correctly with the tongue suctioned up into the roof of the mouth, closed lips, and nasal breathing, if they are open mouth of any sort, the germs, dust, bacteria, everything in the air, that is a red carpet rolling right into those tonsils and adenoids. And so then what's happening? Their air filters, their tonsils and adenoids are just bogged down with junk, whatever's in the air, all the viruses, all the germs, all the things. And so then it perpetuates more mouth breathing and lower tongue posture. So I say that, red flags of sleep dysfunction. If they wake up and their bed sheets are a mess and they're upside down and they're all parents laugh like, oh yeah, they fall out of their bed twice a week, and bump their heads. And I'm like, that's a huge sign. That's not good. So restless sleep. If kiddos are showing their bed is a mess, their hair is a mess, that is an absolute red flag, because that tells me their body is searching. It is trying to get into a good state and it can't. Also, snoring or mouth breathing. Oh yeah, that's the Smith family genes. They all do it. All the men on the Smith side. I'm like, no, that's not good. That everybody is snoring. Snoring is normalized all the time. So kiddos who are snoring, we know it is a proven fact that their IQ scores, mouth breathers and snorers, have a lower IQ score because their brain's not getting oxygen. At night, when our body should be doing so much repair, it doesn't have the opportunity if we're not breathing correctly. So it's messing our cardiovascular system, our digestive system, everything that needs to recharge and replenish, it can't, because we're not breathing correctly. So messy sleepers, falling out of bedders, messy hair, snoring, mouth breathing, night sweats. I'll get kiddos that are, parents like, oh my gosh, yeah, they sleep in their undies and their bed sheets are a mess. They're sweating. That is a sign of sleep disordered breathing for sure. Teeth grinding, a big one. They go to the dentist, like, man, they're having a lot of wear on, front teeth, back teeth. That absolutely we need to look. That's a sign of apnea. So when kiddos are not getting restful quality sleep, if their melatonin is wearing off because they are mouth breathing, their cortisol is going to rise early. And that exchange that happens kind of midway through the night, if we have an early bird, any of these kiddos that are the 4, 5, 6 o'clock wakers, and no matter what you do, they cannot get, I cannot get them to sleep past 5 a.m. We've got to look at their airway and their sleep quality, because if that melatonin cortisol exchange is happening at the wrong time because they are mouth breathing or restless or gut issue, then that is then messing up their gut health as a whole. Their vitamin and minerals are getting tanked, like serotonin, dopamine, everything just becomes a big storm. we don't know. I always say I want proof. So, as much as I don't love the EMF of Apple Watches and sleep studies, an Apple Watch is a great way to throw on a kid, check a couple nights of their sleep, and it can tell us what's happening. Yes, you can go get a sleep study. They have home studies that are great. No one really wants to go into a clinic and spend $1,000 and sleep with wires and cords that it's not their house. They're not going to sleep well. But I say if you got access to an Apple Watch, that's the one time, throw it on your kid, get a couple nights. I know it's EMF exposure, but give me data. I want to know exactly what their oxygen looks like. I want to know where they are rising in their cycles of how much of REM sleep did they get, how much core and deep. And that can be a huge indicator of daytime, whether it's behaviors, inattention, stress, whatever's going on with the kiddo. Sleep absolutely needs to be looked at. Kids are just, we're not investigating because we just think, oh, well, they crashed out in their bed for 10 hours. They're tired. They woke up. They're fine. But groggy wakers, behaviors in the morning, they're not getting good sleep.
Or yeah, those kids who sleep too long. Oh, they like yeah, it's like my kids have qualified for half the stuff you said is like, I had a kid like, oh man, that kid could sleep literally slept 13, 14 hours straight. And she ended up with tongue tie and she ended up with all the things. But it's kind of interesting, even with the grinding, like my middle child that's having all that dental work, she was you could hear the moment she had teeth, you could hear her like across the room grinding her teeth. And at that time I was researching, there's got to be a solution to this. And I'd ask the dentist and they're like, they just didn't know. And I'm like, and then you read about, well, maybe they got parasites. That was the closest thing I could find was that maybe she got parasites. And I was like, oh my gosh. And then, of course, now as I've learned all these things, like, oh, all my kids had all these red flags and I'm an integrative doctor. Of course, I wasn't in this integrative then. I'm integrative now because of the things I learned from them. But gosh, there was like no one who had answers to this.
Yeah. Do you baby that struggled with like connecting sleep cycles, just napping and night sleep as a baby, or she slept good?
She slept all the time. Like, she just was a great sleeper. That kid was asleep at kindergarten. The poor thing when she was at kindergarten, like, her having to get up at, like, suddenly 6:30 in the morning, like, she cried for there was no way I could possibly get her the amount of sleep that she needed.
And she wasn't getting quality. She might have been getting,
Right.
it's even like I love, scrolling or getting pictures of, an infant, like, oh, we've had our baby, the announcements. And I will see pictures and they're like laying on a chest and they're just wide open. Or, they have a cute little newborn photo session. They're on their belly and their booties up in the air and they're scrunched and their mouth is wide open. That is a classic sign. We think it's so cute when their butt's up in the air and they're just, scrunched up in a little ball. That is a classic sign that they were trying to pull oxygen. They need more air. Or, it's like father, like son of just, dad's laying like this, wide open, holding the baby's wide open. I'm like, apple tree, apple. Like that's exactly, that airway piece. There is a genetic component to it.
And sometimes for parents to be aware, I mean, there's definitely a new trend about mouth taping, which makes sense, but if your kid can't breathe through their nose, that's gonna
Dangerous.
stress them out. So I don't know if you want to address that as well, or like when and how to use mouth tape. When would be the appropriate time?
Absolutely. I mean, if you have not had a nasal patency exam and a full airway evaluation, we have no idea if you have obstructions, if you have blockage, if you have inflammation, and mouth taping can cause further sleep disordered breathing if you have any sort of obstruction up here. That does not just mean, oh yeah, they don't sound congested or they're not snotty or they're not, no, their nose seems fine. We're going to mouth tape. I mean, it's pulling into the beauty industry of people, mouth taping. And I'm like, this is so dangerous. It's, we've got water bottles coming out with this nozzle that's going to fix tongue. And I'm like, okay, these are gadgets. We've got to know what's going on and if that's going to be helpful or is that a band-aid?
Yes, thank you on that. Now you've had, 2 boys that have pandas. You wanna tell me about how that's played into your evolution as in your skill set and your gifts that you have?
So I mean, I've always been fascinated by kind of, those not the new up and coming things, but I stay into the research and I've always said, I've chosen to go the functional route of OT because I'm a professional. Why? I'm like, why? Well, that doesn't make sense, just sensory based OT, that just doesn't make sense. And so I was so fascinated after receiving my first case of working with a kiddo and a family that, this kiddo had pandas and just would learn. Just I would go home and just research, like, what the heck, I really at the beginning was like, this is such a behavioral diagnosis. Like this, this kid's out of control, and these parents are just like, they need to parent him. And the more I started learning about it, I was just so fascinated because there's a feeding component for a lot of kiddos with pandas that struggle with a sudden onset of picky eating or food refusal, or they will flat out just like not eat at all. And so in 2021, I was really starting to learn about the underlying components, like, oh, they have an ARFID diagnosis. And I'm like, wait a minute, like this could be PANS. Like, did we end up with this sudden refusal after a virus, after sickness, after COVID? All these things kind of started coming up, and it all kind of collided honestly in the same week. There was a conference coming to Charlotte that I found out about. That's the Medical Academy Pediatric Special
Mhm.
Needs MAPS. And I was like, this is a doctor's conference, but like it's all on autism and PANS. Like, I want to go learn. And so I literally signed up for the conference on a Tuesday or Wednesday and bought Dr. O'Hara, Nancy O'Hara's book on PANS. And that Saturday, my oldest woke up and literally we were on a trip in the mountains and he said, I hate you and I want to kill you. And I was like, he has strep. He has strep.
Mhm.
And my husband's like, "What?" Like, we don't say that. We don't talk like that. Right away it was like behavioral intervention. And so that was a downward spiral. I mean, we were home from our mountain trip within 48 hours. Like it was the worst weekend of our lives. And I was like, I know what is wrong with my kid. And we had chronic medical issues with him, 13 double ear infections in 15 months, 76 doctor's visits, 7 rounds of pneumonia. I mean, the kid was more sick than he wasn't. He had more surgeries, more hospital stays. I mean, it was awful for his first 2 years of life. And we went through a mold journey. We went through a detox journey. We did all of these things and we were honestly in the best place of our lives. We thought, like, I was like, he needs a little gut work, but like, we're doing good. And then boom, his panda's onset hit. And it took us about 6 weeks to get confirmation. I couldn't get providers to run the labs. That I was like, I know what is wrong with my kid. And I also was trying to be very secret about it. I'm like, I'm a professional in the community. And like, if I can't fix my own kid, like, what are people going to think? There was a big turning point professionally and emotionally for me where I'm like, what do I pick? My profession and my image or my kid? And so, we went out of state. I was like, we were on lists everywhere. I'm like, I'll drive, I'll fly, we'll do anything. And so he was symptomatic October of 2022, confirmed diagnosis in December of 2022. And I mean, all of 23 is just such a blur. I feel like I blacked out. I don't remember it. I was literally going to work. I got the EMF filled Apple Watch because he was suspended 16 times in 20 days. I mean, it was awful. And so through that journey, we learned, underlying Lyme and co-infections. And it was like one hit after another. And I would just spend hours. I would go to work. I'd see my patients, get home, and I'm at work with a smile on my face helping all these families and babies, and I'm dreading the drive because I'm like, I have to go home to deal with, I'm going to get things thrown at me and I'm going to get spit on and I'm going to get yelled at and I'm going to be in tears. Everybody's going to be in tears. And so 23, 24, very stressful. My youngest actually had an onset in the summer of 23, 8 months almost to the day. Our babysitter called and I remember calling my husband saying, the babysitter is bringing him. I'm taking him to urgent care. I know he has strep. He was yelling and pulling hair. And I'm like, I know what's wrong with him. Like I know. And my husband, I'll never forget, he just looked at me and he said, we've done it once, Brie. Like, we'll do it again. And I was like, why? I said, I went through a very, spiritual moment where I was like, I do this and I help so many families. Like, why is this happening to me personally? Like, I remember at one point I was like, God, teach me through my work. I'll work till I'm 100 years old and climbing into a casket, but please stop doing this to my children. Hindsight, moving through all of this, I ended up going to MedMap's first conference here in Charlotte. And there was a one of the physicians lecturing made a comment about feeding therapists, and it was a negative comment, like, oh, these feeding therapists and tap dance and food around this and that. And I was like, I literally grabbed my seat and I was like, I am going up to that stage. And I raced up and I introduced myself. I'm like, hi, I'm Brie Kersak and I'm a feeding therapist. And he was like, oh, I should probably know my audience. And I was like, no, because I was like, OTs really don't come to these organizations. I was like, I just wiggled my way in saying I'm a nerd and I like to learn and I'm a pandas mom. So I'm going to get access to the top providers in the country, and ended up striking up conversation with another provider from the West Coast on tongue ties and Airway. And he was like, I need you to meet Dr. New, who's the head of MedMaps.
He's incredible. I
Incredible.
love
See, I roll up, he's got a Michigan phone case, and I'm like, "I'm a Buckeye." He's like, "Oh, a mouthy Ohio State girl, shocker," you know? So we strike up conversation, and he's like I tell him, "This is my job, and this is what I do," and he was like, "Every physician needs one of you. Like, we need an OT that's rolling this functional mindset. Would you lecture for us?" And I'm like, "Oh my gosh, like, what an honor." And so I've been, lecturing for MedMaps and the TACA organization, and hindsight with everything with my boys, I'm like, I think this was just God's way of like, it's a lot different for us to be professionals. And you can be a really good professional and not be a mom. You can be a really good professional and not experience this with your kids. But to have another layer to look at parents to say, I live this. I live this. I mean, this might be the first podcast I've been able to talk about, or, I'll stand on stage. I will still tear up to say, I'm a pandas mom. Like, that is a title I want to put through my paper shredder. But it's also launched me into a place to help so many families to say, I live this. I actually know exactly what your day to day is like. I've had to fight a school system. I've had, we have been to hell and back. And I think that maybe this was God's way of saying, like, I need you to learn this whole other area, be able to help families as an OT, but to be a mom that's dealt with it. So it's been a wild journey. There's been a lot of growing and a lot of pain. It's been a lot of hard, but it's also we as a family, the four of us, like we're in a place that I never knew I could be. I spent the first 6 years of Cohen's life as his medical investigator. I was his fighter, I was his advocate. I didn't have time to connect and bond. It's like now the panda's journey, I truly in my heart, I'm like, it evolved my marriage, my parenting, my career in places that I didn't think was possible. And I didn't realize how stressed and unhappy and my priorities were just so off for so long that it was literally a car driving on the highway that just got shoved into park, and it was like, "Brie, you got to figure it out." I mean, there were moments in 23 where I was like, I wish a boulder would fall off the overpass and just take me out because I don't want to do this. I can't do this anymore. And I just buried myself into work because I'm like, I can go to work. I can help everybody else's family. I can't deal with this. I don't know how to fix that. I was drowning. And we, found the right providers and found the right interventions. And we're not through it. We still have flares. But we're in such a good place. And now my oldest even just told his friends at lunch the other day, when I act crazy, like this is actually what happened to my brain. And, I have pandas and here's why. And I'm like, he came home and told me, and I was just sobbing. I was like, is this another way that this is just going to weave him into medicine to help families to be like, I lived this, I beat the crap out of my mom and dad. I did, I flipped desks at school. I was restrained and held down, and here he's out advocating saying, I have a medical issue. He says germs got into my brain and made me act this way. I'm a good kid. I have a good heart. And so it's been a journey. I 5 years ago, if somebody would have said this is what I would be dealing with at the height of COVID, it was like, oh, you're gonna leave the hospital system, you're gonna launch a practice, you're gonna become a pandas times two mom. I would have been like, how do I sign up? How do I sign up for something else? Like, I don't want that ticket. And now it's been a hard but amazing journey. Yeah. I know. Trust me. This will be the first podcast lecture that I can make it through without crying. It's been hard. It's been really hard. And I think that's what sometimes I still find myself. I dive into work even more. My coping is to go to work to help because it feeds me. It fuels me. I'm like, I can fix other people's kids. I can get the thank you notes, the Christmas cards, the you've saved our life messages. And for so long, it was therapeutic because I'm like, I can't fix my kids. I'll fix everybody else's, and it took a long time for me to be open and public about it. I had providers in town, like they would hear it from a patient where they would go back for their well check or a sick visit and happen like, oh, what's Bree saying about the tongue tie, or what's Bree saying about this? And, you know, the providers were texting or emailing or seeing me out in public, like, what the heck are you dealing with? And why are you so quiet about it? And I'm like, it was my way of coping, being like, this can't come out because if I can't fix my kids, who's going to trust me to fix their kid? And so it was a lonely, quiet few years. And then I hit a place with MedMaps and Taka where I'm like, wow, maybe this is where, I needed
God put you.
I needed yeah, exactly, and I don't think this was coincidental, I look at Cohen's medical history on paper, and I'm like, "How did he not become pandas sooner?" And I'm like, 30 days before his onset, that weekend in the mountains, 30 days prior, I looked at Brian and I said, "I really think something bad is gonna happen. I feel like this bad feeling is," and he's like, "Why would you put that in the universe? Like, why would you even say that?" And I said, I don't know what it is, but I really feel like we have to really kind of tackle some gut healing and we've been coasting. I feel the need to like move a little bit. And 30 days later, boom.
That mother's intuition.
I knew. It was like, and Dr. O'Hara's book purchase and MedMaps being here in Charlotte, all of these things. I'm like, it was like wrapped up in a pretty little bow to be like, here's what I'm serving you. And it's going to suck for years, but it's going to get better. I don't know. I don't know how I came out alive. I truly don't know how I survived it. But now I'm like, it's just launched us into such a great place. And I hold that with parents to say, I know your infant that's colicky and screaming. We're not going to normalize it. We're going to fix it and it's going to get better and you're going to heal and your baby's going to heal.
I resonate. Yeah, this is again, like I said, my whole clinic is born out of the things that happen with my kids and not be able to find solutions elsewhere. And it's hard for parents. It's hard financially for parents to like there were things I did for my kids, tests I'd get back and like because no one else could do it. I'm like, oh my gosh, it's just too overwhelming for me. Like I'm just gonna have to like
To it. People, I think sometimes we're looked upon as their provider and their hero and their helper. And we're people too, right? We're running a business, we're parents, we're marriage, like all of these things behind the scenes. You just don't talk about it because otherwise it's like, well, you're weak and you're overwhelmed and you can't manage. It's like, no, we're still humans. We make mistakes. We're not perfect. I've messed up some kids. I've sent apology letters, text messages, phone calls. Like, I can't believe I missed that. But at the end of the day, I always say I took that medical license and I wear it with a badge of honor saying we're doing the best we can with what we know. I mean, years ago, I was telling parents to run off and I met them on Thursday and I'm like, go get the tongue tie released tomorrow. That's what we're trained to do. It's like we're learning too. That's why you practice medicine. We're practicing.
right. Yeah, it's just like as you're telling the stories, I mean, I just see flashes of my memories of my kids at the various stages that you spoke about. This has been really incredible. And again, I you're kind of famous for what you do in the area, obviously. And so we're full of gratitude for all that you're serving and then teaching other OTs how to do this as well. And I suspect that after people hear this and the providers in my clinic hear this and hopefully other doctors hear this, then they're like, "Oh my gosh," they're gonna think about a whole bunch of patients that they
Yeah.
would do something differently
Yeah.
with this information. So full of gratitude for all the information.
Thank you for having me. It was such an honor. When you sent this, I'm like, oh my gosh, Dr. Ben wants me to hop on her podcast. It's an honor. And I feel like this whole journey, just like you said, the things that we do with our practices, it's born out of, hardships and it's not easy. And, a website might look a certain way or social media a certain way. It's like at the end of the day, we're still dealing with the same things our families are coming to us for, and that's what's kind of beautiful. So
Like, it got me all emotional.
it's so funny. I have to like go through and, I'm big into homeopathy and have to dose before these, when I do podcasts and things because I get myself revved where I'm like, okay, you're not going to get on there and cry. You're not going to, and I think that's part of crying is so healthy and so good. But it's been such a journey in how I feel like I've kind of weaved from an OT aspect. It was like, oh, I just, used to do sensory and autism and then just kind of keep the path has been wild, just wild. So, but it's been a gift. I don't feel like many people wake up and go to work loving their jobs. I There is not a day that I leave my office. I literally lock the door and it's like you have to punch the code and then give it a little wiggle and I give it the wiggle and I'm just like I get paid to do this. Like what a I could die
Gratitude.
I could die tomorrow and I would say I am so grateful I had an opportunity to help so many families and so many people and to be a household name and to get Christmas cards and letters and all the things. I'm like, what a gift because that is not something everybody gets to do. And I get to help heal kids. It's so
Yeah.
cool.
Yeah, the same and grateful that God gave this gift to us and
Yeah.
the ability for our kids to get better. So they kids did the work,
Yeah.
the
I mean,
kids
what
did
are
the
we
work for
doing?
us,
We're
yeah.
we're teaching our kids, I always say to them, we're healing hurt, right? Our childhoods, our grandparents' childhood, all of this. I'm hoping that someday my boys, I don't ever want them to look at me and like, thank you for everything you did for me. That's not, I want them to pay it forward. I want them to be in such a healthy place that they end up in a healthy marriage. They end up in a healthy, career that they love, whether it's in medicine or not. Some days I'm like, don't go into medicine, but it's a gift to pay it forward. So thank you so much for having
Mhm.
sharing this.
Well, thank you.